Hello, my name is Dr. Christopher Stralka, and I'm the Medical Director for Julia Hospice and Palliative Care. And it's my pleasure today to welcome you to the next in our series of informational webinars on important topics in both hospice and palliative care. Our webinar today is entitled The Future of Hospice and Palliative Care in Erie County. At the conclusion of today's webinar, we want everyone to be able to describe the current state of hospice and palliative care services available for those living in Erie County, to be able to describe Julia Hospice and Palliative Care and its unique services and how it will be different from the current hospice providers in Erie County, and lastly, to be able to describe the key features of our Julia House. Julia Hospice and Palliative Care Incorporated is a registered nonprofit corporation in Pennsylvania that was established in May of 2019. It was founded by my wife Julia and myself. My wife Julia is a lifelong educator and spent the end of her career for several years as a school principal, where she developed very important administrative skills. My background is I've been a physician for over 30 years, and after completing surgical training, I came to Erie and practiced as a cardiothoracic and vascular surgeon at Hammett Medical Center for over 16 years, then retired from surgery and did a one-year fellowship in hospice and palliative medicine at the Cleveland Clinic before returning to Erie and serving as the director for palliative medicine and supportive care services at St. Vincent Hospital for almost 5 years before retiring again in 2019. The Julia Hospice and Palliative Care Incorporated, the corporation is mainly just a board of directors, important individuals in our community that brings specific skills that we think can help advance our mission. Right now, we are creating the infrastructure of our corporation that will eventually own and operate a Medicare-certified healthcare agency providing hospice and palliative outpatient palliative care services, as well as owning and operating the first residential and inpatient hospice facility ever in Erie County, Pennsylvania. It shouldn't be a surprise to anyone that Erie County is getting older, sicker, and unfortunately more debilitated. We meet or exceed the state and national averages for the number of residents who are 65 or older. Almost one half of these residents are living with and trying to manage at least one potentially life-threatening chronic serious medical illness. And 40% of these individuals are requiring daily assistance with at least one basic activity of daily living, dressing, toileting, bathing, or feeding. Erie County is becoming more impoverished, again, compared to the average in Pennsylvania, and nationally we exceed the number of individuals living at or below the federal poverty level. Our residents are spending more time annually in nursing facilities. That trend may have been broken this past year because of the COVID-19 pandemic, but up to that point, we had in 2019 almost 40,000 county residents spending at least some period of time in a nursing facility. We still have too many people dying outside of their own homes or chosen place of residence. When people at the end of their lives are given a choice, more than 80% want to be in their own homes. In 2017 was the first year in the United States that decedents died in their own homes, exceeding 30% for the first time. Compared to other countries, we're still behind. 60 to 65% of residents in Canada die in their own homes, and almost 50% of residents in the United Kingdom. There are 6 Medicare certified hospice providers operating in Erie County, none of whom own their own residential hospice house or inpatient hospice facility. It's my opinion that very few, if any, hospice patients receive inpatient hospice care, which is a higher level of care needed for short-term crisis management. Annually, 1 out of every 4 hospice patients requires or needs this higher level of care. Palliative care services are limited to primarily consultation services at the two major hospitals, available only to inpatients. Once someone's discharged from the hospital, there's no provider of out-of-hospital or community-based palliative care services in Erie County, either in someone's home or in a outpatient clinic. There's a national workforce shortage in hospice and palliative care. Based on the population of Erie County, we need at least 8 board-certified hospice and palliative medicine specialists. We only have 6, and of the 6 that we have, only 3 are actually practicing. So the workforce shortage is even more acute in Erie County. Based on these demographics and knowing that Erie has been behind the times as far as the lack of a residential or inpatient hospice facility. These facilities have been available in the surrounding communities of Cleveland, Pittsburgh, and Buffalo for 25 years. And there's even smaller residential hospice houses in both Meadville and Warren, Pennsylvania, that have been in operation for more than 10 years. Our nonprofit, again, was established and registered in Pennsylvania in May of 2019, and we received our 501c3 status in April of last year. We will eventually own and operate a Medicare-certified healthcare agency, providing comprehensive hospice and palliative care services outside of the hospital to the residents of Erie County, Pennsylvania. We will also own and operate the first residential and inpatient hospice house ever in Erie County, called the Julia House, which will be conveniently located off the I-79 in McCain, Pennsylvania. We are working tirelessly, raising capital funds needed to construct the Julia House and staff our healthcare agency. And we know that these needed services have been needed for a long time, and we're doing everything we can to bring these services to the community as quickly as possible. Our mission is to provide comfort care, caregiver support, and bereavement services to all those who are approaching or at the end of their lives, and to provide care management and support care services to all of those living with any serious illness. We are interested in enabling well-being, not just health, but both health and happiness for anyone who entrusts their care to us, using a combination of unmatched skill, compassion, and patient advocacy. We want our services to be available to all those who need them and who are eligible for them, regardless of whether they have health insurance or have the personal resources able to pay for the services. Our core services include hospice care or specialized end-of-life care, not just in someone's home or place of residence, but for those who lack a caregiver or don't have the resources to stay in their own homes, to be able to offer them the ability to live and receive specialized care 24/7 in a state-of-the-art facility, inpatient hospice facility, the first of its kind in Erie County, Pennsylvania. We will also provide comprehensive palliative care services or quality of life care services for all those living with a serious illness and in the community, either in their own homes or in our own outpatient palliative care clinic, the first of its kind in Erie County, located at the Julia House. We will provide a host of complementary care services, including art and music therapy, exercise therapy, massage therapy, access to integrative and functional medicine, and other non-traditional services in keeping with our commitment to a holistic philosophy of care. These services will be available for all those living or staying at the Julia House. And finally, we will provide full bereavement care services and family counseling services for anyone struggling to cope with the loss of a loved one. Our services will be different compared to the other providers in the community, because we feel that we have a sincere commitment to addressing all of the components of well-being, including physical, emotional, spiritual, and cultural factors. We want our care to be as personalized as possible, and to address the entire person, not just treat an illness. We believe strongly in participatory care and hope to partner with both the patient when they can, but certainly the families, in developing the most meaningful and personalized plans of care to enable not just health, but both health and happiness or well-being. We will strongly encourage our staff to seek and achieve the highest credentialing in hospice and palliative care and provide specialized training for them, so that on day one, when our services are available and the Julia House is open, we will be the only provider in Erie County capable of meeting and exceeding the national standards for quality and national benchmarks, and also be the only provider capable of achieving special accreditation in both hospice and palliative care. The Julia House will be the first residential inpatient hospice facility of its kind ever in Erie County. It'll be between 10 and over 15,000 square foot facility with a patient capacity of either 9 to 18 patients. The size and capacity will be completely dependent on our ability to raise the necessary funds to build the facility and staff the agency. The Julia House will have special family spaces to allow families to share meals together, celebrate special occasions together, and continue to make special memories together, as well as community events and spaces, in that we plan to be a dedicated partner to the McCain community. The Julia House will be the location of the first outpatient palliative care clinic available in Erie County, Pennsylvania, open between the hours of 8 and 4 p.m. daily, capable of accommodating walk-ins, but will also have scheduled appointments. And the palliative care clinic will be fully equipped for telemedicine for those who have that capability. Julia House will be located on 13 wooded acres in McCain Township, McCain, Pennsylvania. Again, very close or just off the I-79 interchange, within several miles of the I-90 and the Mill Creek Mall. To make the Julia House and the services of Julia Hospice and Palliative Care available to the community, we need the support of everyone in the community. We know that more than 90% of the people who will need our services and use our services will be low to moderate income, and we will not deny anyone services who need them or who are eligible for them, regardless of their ability to pay for the services. We need to raise between $2 and $3 million to build the Julia House, and we know that we will be a strong county employer, employing between 30 and 40 full-time specialized clinicians. For those interested in wanting to learn more about Julia Hospice and Palliative Care, or wanting to help us in our mission, please visit us online at juliahpc.com, where you will find several important resources, including a secure donation portal for those who are able to make a gift to help us meet our capital need. You can also subscribe to our monthly newsletter, where you can stay up to date on all the news related to the progress of Julia Hospice and Palliative Care. You can visit us on social media or Facebook on facebook.com/JuliaHPC. That concludes today's webinar. Thank you for your attendance. Please visit us online, and where you can see our list of webinars, and there will be links to YouTube where you can watch the webinars at your convenience. Thank you again for your attendance, and have a nice day.